Tonight, we are learning the jury trial for Andrew McGann has been scheduled for next year in Washington County Court. He's the man accused of killing 2 people at Devil's Den State Park last summer. A court order filed today says a Washington County judge set the trial for March 29th through April 14th of next year. McGann is accused of killing Clinton and Kristen Brink on a hiking trail at Devil's Den while they were there with their 2 daughters. If convicted of capital murder, McGann faces the death penalty. All new tonight at 10, the CDC is monitoring an infectious foodborne intestinal illness. Health leaders say it's caused by a parasite and can spread after consuming contaminated produce or water. There are no new confirmed cases in Arkansas, but as Tamara Knight reports, the state health department is already monitoring patients with symptoms consistent with this infection.
State health officials are investigating an increase in confirmed local cases of cyclosporiasis, a parasitic illness linked to contaminated food and water. The CDC has recorded cases in many states this year, though officials haven't identified a single food source linking all the illnesses across all states.
It's food contaminated with feces of someone who or an animal that carries the parasite. It gets on the food and we eat the food, right?
The infection most often spreads through fresh produce contaminated with the microscopic parasite Cyclospora. In past outbreaks, investigators have linked cases to bagged salad mixes, raspberries, cilantro, and other fresh fruits and vegetables. And this isn't a new illness. Since 2020, Arkansas has confirmed about 70 cases.
There are cases that are being investigated here. At the moment, we do not know if it's associated with what we're seeing across the nation. But we do get cases of cyclospora, every year.
Doctors say symptoms can be severe, similar to a stomach bug, but potentially can last a lot longer.
If they're experiencing symptoms, a week or so after consuming, some fresh fruits or vegetables or something that may be associated with this ongoing investigation, then, it's advised that they consult with their primary care physician.
While investigators work to determine whether the recent rise in Arkansas cases are connected to a national increase, officials say everyone can take simple steps to reduce their risk.
Washing your hands, washing your fruits and vegetables before eating them is the best way that you can protect yourself.
That was Tamara Knight reporting. Now, direct-to-direct transmission of the disease is unlikely. Again, it is spread through eating contaminated food. And by the way, New York, Illinois, and Texas are the states with the majority of confirmed cases, according to the CDC. Well, July is Minority Mental Health Awareness Month, and mental health professionals say breaking the stigma around asking for help is more important now than ever before. The American Psychiatric Association says African Americans and Hispanics are less likely to get specialized mental health treatment these days. Mental health professionals say mistrust of the healthcare system, along with cultural beliefs and access to care, have contributed to a stigma surrounding mental health.
Like we're seeing more people of color, Black people who are more open, at least to the conversation about seeking mental health treatment. But yes, of course, historically, there has been a stigma. I think part of it can come from a understandable and valid mistrust of the healthcare system. Mental health and healthcare in general hasn't obviously always been kind to people of color.
Doctors say education and conversation can help break that stigma and connect more people with the care they need. State of Arkansas can now skip some federal education hurdles, giving state leaders more control over school funding. U.S. Department of Education approved Arkansas's Returning Education to the States waiver. The approvals put more control over federal education funds, with the state allowing leaders to reduce administrative requirements, streamline funding, and increase flexibility for rural districts. The governor says it means more resources can pour into classrooms.
Less paperwork that our districts and our state have to provide to the federal government, fewer tests that our students have to take, and more flexibility for our teachers so they can focus on their real job, which is educating our kids.
Education leaders say the waiver will reduce duplicate reporting and give schools more flexibility that could in part improve outcomes. Arkansas is the 5th state to be granted this waiver.